Sairam and welcome back to the post-lunch session of day 2. This is a crucial session on cardiac emergency management and we urge all participants to pay attention, learn and upskill yourself. This session will be led by Dr. Hiremath and Dr. Pooja from Sri Madhusudan Sai Institute of Medical Sciences and Research, who will first teach us what to do in a cardiac emergency. Knowing how to respond in those first few moments can make all the difference between life and death. Dr. C.S. Hiremath is the Director of Heart Valve and Academics in the Department of Cardiothoracic and Vascular Surgery with over 25 years of experience. He is known for his leadership and expertise in the field of CTVS and surgery. Dr. Pooja Natarajan is a Senior CTVS anesthesiologist and assistant professor with specialized training in cardiac anesthesia and intensive care. She holds multiple prestigious fellowships and brings strong expertise in managing high-risk surgical and critical care cases. This will be followed by demonstration and hands-on training on CPR and essential part of our cardiac emergency management session. This segment will be conducted by expert teams from the CTVS, Cardiology, Anaesthesia, Critical Care and Emergency Medicine departments. Participants will get the opportunity to observe and practice key life-saving steps in responding to cardiac arrest. We encourage everyone to pay close attention and take part because these are skills that can make the difference when it matters most. Over to both of them.
Hello, am I audible? This is also working? Okay. Sairam, good afternoon everyone. My humble pranams to the lotus feet of Sri Madhusudan Sai Swami sir. Today I'll be telling the importance of cardiac emergency for the bystanders. So we are going to basically have a hands-on session of CPR training for the basics. Like if you see a cardiac arrest, anybody not responding, somewhere when you're walking on the lay, then you can, help the patient. So how we go about stepwise is what we are going to look at. So this consists of our team who is going to help us learn better today, okay? So basically we have taken from the American Heart Association. So we have the adult out-of-hospital cardiac arrest protocol where you first identify and then you start the CPR. Then you have the AED device, that's the automated external defibrillator device, how to use. We are going to demonstrate today. And then you call for help, ambulance arrives, and then you go to the hospital and then recovery phase. That's how the chain goes on, okay? So how do we go about? So that's the steps, various steps we are going to tell each in the upcoming slides, all right? So first thing what we do when a person is found unconscious when you're walking on the roadside or anywhere for that matter. So first you will verify scene safety. So what does scene safety mean? Close. Okay, thank you. So what does scene safety mean? So if a person is found unconscious, always see where the patient or the person is lying. So if he is lying down in a water body, always make sure there are no electrical wires going in that water body so that you don't go and get electrocuted, okay? Or if it's a drowning body, again, you don't know how to swim and you go and try to help. So basically, scene safety is for your protection. First, protect yourself and then go to help anybody else, okay? So always see what's happening around and then go to help. Second point, you first call for the patient. How? You say, hello, can you hear me? Is there any problem? Is there a response you elicit from that person? If not, then you tap on the shoulder of that person. If still there is no response, then you go to the next step. So you call for help loudly because you alone can't do everything. If you have a phone, you're not finding anyone, please call the emergency number. If not, please ask someone to call, and meanwhile, you continue the process of resuscitation. So always shout loudly and call for help. So next what do is you check for breathing and simultaneously check for whether patient has a carotid pulse. So carotid pulse, what does it signify? Whether your heart is beating adequately or not. So that will be checked, and we are going to demonstrate the same. Take around 5 to 10 seconds, no more than that. If the patient is breathing, if the carotids are felt, leave the patient alone and then call for help if he is not responsive. Otherwise, if he is recovering, let him recover, okay? But meanwhile, do call for help. Second thing, if there is no pulse, then you start for CPR. If there is no breathing, then you assist breathing if possible. It's not mandatory because it's a little complex. So rescue breaths, this is what is recommended, but mouth-to-mouth breathing, it's not that very, comfortable for everyone to do. So it is not a compulsory thing to do. If you have a pocket mask, then well and good, you can do it, but nobody carries it around. So it's not a practical thing to do. If you're doing it in case your own relative at home, then every minute, at least 10 breaths, make sure you give, okay? Next, another very important thing nowadays especially, mostly seen abroad, but in India, especially in cities like Punjab, where there's a lot of, drug abuse, opioid poisoning is very common. So wherever you go, in the emergency kit, that's the AED box, which is available in any of the airports or any open spaces in the malls and everywhere, usually a naloxone will be kept. If in case you have a doubt, just put some naloxone in the nostrils, okay? AED is automated external defibrillation. So this is attaching pads on the chest of the patient. You continue CPR. Meanwhile, when you call for help, somebody will get the AED, and then you attach the paddles, and then you wait for the machine to analyze the rhythm of the patient, and you can, if it gives a command of shock, then you shock the patient, which we are going to show it eventually. So once you start the compression, so how do you give the compression? That's the most important thing. And why do you give the compression? Why do you prefer compression over giving breaths? Because the idea is whatever little oxygen is remaining in the body, that has to be circulated, because brain is the first organ which gets affected when the patient arrests. So you continue the circulation by giving CPR. And the right way of giving this chest compression will be demonstrated today, okay? And everybody will get a hands-on. Thank you. So now we are going to have a short scene demonstration. Dr. Avnish is our cardiac anesthetist who is going to help us. So now he's found a patient who is lying on the roadside, and this is what he will be doing. So first he will go and look for scene safety. So he feels the scene is saved. So next he will, so he is going to tap the patient.
You should hold the mic to him. He will be doing the procedure. One of the boys, can you help him to hold the mic? Hold the mic with him.
Yeah.
Yeah, as he is talking, be close hold the mic for him. Yeah. Okay. Please go ahead, Avnish.
First step for resuscitation is first I'll verify the scene safety by looking at is it safe to do resuscitation. Then I'm going to tap the patient and call his name if I know. Otherwise, hello sir, how are you? Are you okay? I am confirming him. And then next step is call for the help. I need help. Please somebody come. And then I'm going to check his pulse as well as his respirations for 5 to 10 seconds.
So Shivu is our cardiac ICU brother. So he is going to find an AED if it's available. If not, he's just going to make a phone call and call for ambulance.
Okay. I'm going to check his pulse, that is commonly used as carotid pulse, which is just adjacent to the thyroid cartilage. This is Adam's apple for 5 to 10 seconds. And at the same time, I'm going to observe his respirations. If he's not responsive, there is no pulse and there is no respiration, I'm confirming that patient is requires CPR. So I'm going to start CPR. Next, I will use my dominant hand in the middle of the chest, sternum, and I'll use other hand to support this. See, by holding this, and see, I'm going to press the middle of the sternum to give the circulation. Like this. 1, 2, 3, 4, 5, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Bystander CPR, we don't give any respiratory support, but my help is arrived, so while continuing CPR, please connect the AED to the patient. I am continuing the CPR.
So every 30 CPR count, 2 breaths is followed by that, okay? So because we do not have anything to give breaths to the patient in the roadside, we are not going to do that. But if it is your near and dear ones at home whom you are okay to give breaths, then you can go ahead and do.
Sometimes you can use a small gauze piece. When direct mouth to mouth sometimes becomes difficult to touch each other's mouth, you can use a gauze piece and try to blow the air in emergency.
Check for the prompt. Actually, AED is an intelligent device. It will guide you. It will automatically assess the heart rhythm, and if it is a shockable rhythm, it automatically delivers rhythm, and after that, it will prompt you continue the CPR.
So meanwhile, they're going to attach the paddles, and then when you switch on the machine, the machine automatically reads the rhythm of the heart. So if it feels that it's an abnormal rhythm which is shockable, it will say shock has to be delivered. So there is a simple button, you just have to press it. But make sure you stay away from the patient, otherwise you will get shocked too, okay?
It has 2 pads, one is sternal pad and one is apex pad. I am attaching sternal pad here and apex pad here, and we'll switch on the monitor. It will give you whether this is shockable rhythm or non-shockable rhythm. If it is shockable rhythm, it automatically gives shock. Then it will prompt you start the CPR. So after this thing, we are going to restart the CPR again. 1, 2, 3, 4, 5, 6.
If you observe the way he is giving a massage, it should be very clear that the elbow joint should not be flexed, straight. The moment you flex your elbow joint, it is not effective. And one should always remember that every 3 to 5 minutes, the person who is giving massage should change. He will feel tired. If it doesn't change, then the massage is not effective. The massage is done to maintain a minimum mean blood pressure of 60 millimeters, which is an end organ perfusion. Less than 60 millimeters, if you press very slowly, there will be end organ damage. Either brain and kidney are the commonest ones which get damaged. The purpose of doing a bedside CPR is very less. Meantime, other emergency, as Dr. Pooja mentioned, that we need to call for help and the ambulance. And she gave clear instructions, giving a shock. All these things are done by people who are trained. There's something in this course, there's something called as basic life support, that is BLS, and advanced life support, that is ALS. So basic life support, every Indian or every person on this earth should be knowing. That's where our institute is making an effort to see that every Indian has been trained on this, including security guards, anybody as particular. But where it comes as advanced life support, it's only a medical person can get it to be done. So till we get the medical help, the basic life support should continue. And that's where we are demonstrating, and we request participation because there are more than 8 to 10 modules kept, mannequins, what we call it as, wherein you can do it and have a first-hand experience on that. Yeah, over to Dr. Pooja, please.
One more point, the depth of CPR is like 2 inches or 5 centimeters, and we have to allow the chest to recoil completely. That is, once you press, if it is 5 centimeters, then release it. It has to come to normal point, then repress it.
Okay, now we would like the groups to be 12 each. So 12 each can, go and stand next to the mannequin, and you'll have a tutor to demonstrate. All right?
Any doubts are always welcome, you can ask. This is the basic life support, what we are teaching, how it should be done. These are what you are going to practice are called as mannequins. This is how today medical fraternity are getting trained with these mannequins, including whether it is intubation or giving an intramuscular injection and even operating, everything has been taught on these, rather teaching on humans. So, one baby also is here. If you want a baby massaging is different. If you massage like that, then baby will not get up only afterwards. Baby massaging is different. Hello. Yeah, Dr. Harsha will show you that. Yeah, thank you. In real life, actually overcrowding should be avoided because already patient is deprived of oxygen. There will be minimal people. If you crowd like this, whatever patient, even because the oxygen will be consumed by all of you people, no patient will not get oxygen only. Okay. So always, whenever somebody arrests, minimal people call for help. If too many people come in, then patient will not get up. One more important feature is whenever the patient is lying on the bed, the underneath surface should be a hard surface. For example, if you have a silicone beds as in our hospital, we need to have a plank underneath so that whatever compression is given, that the heart should bounce back. What happens if the underneath bed is soft? Then as you compress, it goes down. You won't have an effective massage. Always underneath the wooden plank has to be there if you don't, if the bed is not strong. Here you see the floor is strong, so you can give a massage. But if the underlying bed is soft, that time we need to keep a plank. So always in intensive care, we always have a plank in the ICU. Similarly, whenever outside, if the floor is always strong, you can always give a massage. All of you practice. You should feel tired. Then only you have done an adequate massage. Otherwise, your massage is not effective.
Let's say if someone collapses in its own bed, then you have to bring them onto the floor. Let's say if in their room they don't have something hard. So it's always advisable to put them down on the floor or correct.
The massage should be done on the lower end of the sternum, not on the sternum or on the breastbone. It should be done on the lower end of the sternum. Oh, she is massaging in such a way the patient will not get up only. Hello? This is the time to learn. You have to sweat. You have to sweat. You should feel tired. Then the next person comes. Then only massage is effective. If you don't want the patient to be alive, if you relative and all, if you don't want him to be alive, then you can do massage whichever way you want. But if you want him to get up, then definitely you have to do the first. Dr. Anand Agarwal has kept this session immediately post lunch so that you have good digestion what you have eaten by doing these exercises. Amma, hello. ನೀವು ಅಲ್ಲಾಡಬಾರ್ದು. You should not, body should not shake like this. She is fully shaking her body. You should not, that's not correct. ಅದು ಒಳ್ಳೆ ಬಟ್ಟೆ ಒಗೆದಂಗೆ ಮಾಡ್ತಾ ಇದ್ದೀರಪ್ಪ ನೀವು. ಆ ಥರ ಮಾಡಬಾರ್ದು. ಕನ್ನಡ ಬರುತ್ತಾ? ಕನ್ನಡ ಬರಲ್ಲ. ಲೈಕ್ ವಾಷಿಂಗ್ ಕ್ಲೋತ್ಸ್ ಯು ಆರ್ ಡೂಯಿಂಗ್ ಅಟ್ ಹೋಮ್, ದ ಮೇಡ್ ವಿಲ್ ಬಿ ವಾಷಿಂಗ್. ನೋ, ದ ಪ್ರೆಷರ್ ಶುಡ್ ಗೋ. ತೋರಿಸಿ ಅವ್ರಿಗೆ ಕರೆಕ್ಟಾಗಿ. Your body weight should fall on the patient. Your body weight should fall on the patient. Ma, you should kneel down. You are sitting comfortably. You should not sit. You should kneel down and then massage. If you sit in Vajrasana position, then it's exercise good for you after digestion. But for the patient to get up, you should kneel down. And then only body pressure will fall. You are sitting in Vajrasana and trying to do massage. That will not work. All done. They're tired already. I hope everybody had a practice who are sitting there. I am seeing from behind, I am seeing how best massage is going on. Your whole body weight should fall on that patient's heart. You should count when you are doing 1, 2, 3, 4, 30 count should go. They will show you small baby separate demonstration will be there. All have practiced massaging the heart. Hello. People who have not started, please start massaging the heart. Cardiac arrest can occur in the flights also, wherein any doctor or if no doctors are there in the flight, you people have to learn how to massage if you are on the flight and immediately alert the crew members. Flights will be diverted. Flights will be diverted and emergency landing will be done. These are all the standard protocols. You can see that video once. You can see the video how he is massaging. That's where non-stop 30 times. You should count when you massage. 1, 2, 3, 4, 30 times should count. And meantime, if you are alone, continue massaging. In between that gap, call for help. I think people who have not yet massaged are clapping, I think. Some can come and do massage on this mannequin, no? Muksun किधर है? Okay. Always the position is very important. It is the lower end of the sternum, breastbone. If you go still lower down, you will start massaging the stomach, which will be of no use. In fact, patient will aspirate if you massage the stomach.
In between said 1 hour, 2 hours after. Sir, please. Sir, even if we are safe, also opposite person has to be safe, sir.
ತೋರಿಸ್ತೀರಾ pediatric? ಅರೇಂಜ್ ಮಾಡಲಾ?
Then we might, we have a talk and then some parallel discussion.
If all are done with the adult cardiac massage, we would like to show on the pediatric mannequin. If you are, all are done, or still you need some more time? Charan, everybody done already here, this side. City? ಇನ್ನೂ ಆಗಿಲ್ಲ ಎಲ್ಲರದು. There are some mannequins free. People who have not done, please practice on that. Yeah, we are done. I request Dr. Harsha, our pediatric HOD, to come up on the stage and show them the pediatric mannequin, how to do a massage in a baby. You have done, you have learnt a massage in an adult now. Dr. Harsha, where is? Yeah. One of you go.
It's okay.
Yeah.
So in child, the initial steps of activation are the same. Only for checking the pulse, you check on the inside of the arm with the 3 fingers. Like you have to press. Or little big child is there, you can either see the carotid or the femoral. So pressing with an hand, complete this one, you will have more pressure on the chest. So what you do in an infant is, when you are single, you do with 2 fingers. Same, just below the line of the nipples, 1, 2, 3, 4. It is 1.5 inch or little bit 4 centimeters depth. So you can easily do with the fingers. Make sure that your nails are not digging into the chest. So when you are other person to help, or this is one person is there, so that I should not waste time giving the ventilation. So 2 persons, so single person it is 30:2 ventilation. So when there are 2 persons, then other person will take care of ventilation or other things. So I can use the encircling technique. So the thumb. So 1, 2, 3, 4, 5, 6, 7, 8. After 15, if second person is there, you will give 2 breaths. So when you do this, remember you don't flex your thumbs. So that if you are flexing your thumbs, your nails will be digging into the skin of the chest and injuring the chest. So it should be movement from here. You are encircling here the chest, and so this gives better compression than giving it 2 fingers. But when you are alone, you are wasting time to give ventilation. That's why they said you do with 2 fingers. So when 2 rescuers are there, you can use the encircling technique. So that is the change, and you are checking the pulse at this one. So when you are attaching the pads, if 2 big pads are there, you can attach 1 pad in the front and AED for shock, and 1 pad at the back. If pediatric pads are available, one is at right side of the chest and other is little bit lower on the left side. So it should not come in the way of compression. That's or suppose someone is having a pacemaker, you should make sure that pads are away from the pacemaker.
Yeah, thank you. Any doubts on cardiac massage, basic cardiac massage in an adult and pediatrics? No questions? One question was asked during that. I asked them to have a hard surface underneath when you do a massage so that the heart bounces back. In the soft surface, you slowly the chest goes on becoming at an angle down. The massage will not be effective. So if you are alone, wherever you are, start a massage, call for help. As you call for help, then the patient can be shifted down in a hard surface on the floor, or in the hospital you can put an underneath plank. Always in the ICU should have a wooden plank so that whenever an arrest occurs immediately, so that the massage is effective. Otherwise, the required generation of 60 millimeters of mercury pressure is not generated. I would like to share on the lighter note, when I was doing my post-graduation about 25-30 years back, midnight 2 o'clock, I was held up in the operation theater and had an emergency call from the emergency of that hospital that a patient has come cardiac arrest. So those days in our, as a resident days, we were the first on call, what you call as a cold blue, where you run, everybody runs to save the patient. So I just on the phone, I told him, start cardiac massage, I will come. So by the time I ran, I saw the person, you know how he was massaging? He was massaging like this. Before I could take some classes, he disappeared from there. But people are not aware what is a massage. Massaging has to be done like that, not like this. Even he thought this is a massage. That's a regular body massage what we do. But in cardiac massage, we need to give pressures to maintain adequate pressures. Because the first 3 minutes are very important. Within 3 minutes, the brain oxygen supply goes off. Then the patient will be alive, but he will be like a vegetable, what we call it as. That means he will not be recognizing you. He'll be only on the bed because they will cause cerebral hypoxia. That's why cardiac surgery, why intensive care, why 1:1 nursing, we struggle at every time, because the time given by God is very less. The time given by God is very less. You don't have time, so that your reactions, your reflexes should be very fast. If reflexes are slow, then it will be very difficult. So reflexes has to be fast to see that end result is patient has to go home. Everybody looks at the results. So definitely people have massaged for 1 hour. There are incidents where we end up massaging 1 hour. This is what we tell for regular people, whether a layman should know massage. This is external massage. There is something called as internal cardiac massage that we cardiac surgeons do, where we open the chest. If this is not working, we don't sit quiet. We pull him to the theatre just to open the chest. If it is a post-bypass surgery and all, normally they arrest. So immediately we open in the ICU or in the OT and we massage with the heart, with the hand. That technique is different. I need not tell you those things. Even that technique also, while training the doctors and all, people have, their fingers have gone into the heart itself, okay? That patient won't get up again. So all these things are there. This is internal cardiac massage. What you learned till now is external cardiac massage, which every person should be knowing this. I think with this we come to a conclusion. Dr. Agarwal, sir, with your permission. Thank you. I request all the my colleagues who had demonstrated, Dr. Pooja and other team members, to come down for a group photograph.
I must congratulate the cardiothoracic vascular department team, anesthesia and critical care, pediatric department, and an emergency department. Give them all a big hand of applause. I think with the 100 days celebrations coming up, I think it is mandatory that everybody should be trained. As a matter of fact, any person should be trained in basic life support. Even if you can save one life in your whole lifetime, I think it is worth learning. Thank you.
To know the statistics, only 3% of the Indian population are trained in basic life support. Just imagine to what extent the training should happen. Sadhguru's mission is that every Indian be trained, and we are stepwise going ahead to that goal to see that now we train, you people go further and train others also.
Thank you, everyone. Request Dr. Anand Agarwal to kindly hand over token of appreciation from the CTVS department to first Dr. Hiremath. And to Dr. Pooja. From the support team, I call upon Dr. Abhishek. Dr. Sajid. Dr. Avnish. Dr. Charan. Dr. Harsha. Dr. Pratap. Mr. Anji Nayak. Mr. Shiv Kumar. Mr. Narendra. Mr. Mukunda. Peer Saab. Sister Usha. Mr. Tejaswini. And Sister Gauri. We request everyone to come for a group photograph, please. Mr. Yuvraj. Please give them all a big round of applause for their patient demonstration and teaching all of us. Thank you. As the final speaker for today, we invite Dr. Asha Benkappa for a talk on the topic From Chronic Disease to Vibrant Health, where she will share her personal experience and insights on the journey to lasting wellness. Dr. Asha is a senior pediatrics professional with over 40 years of experience and currently serves as the head of Department of Pediatrics at Dayanand Sagar Medical College. She is widely recognized for her work in health equity, breastfeeding advocacy, and public health education. She has contributed extensively through research, publications, and policy engagement. Dr. Asha, please.
At the outset, I would like to thank Dr. Anna Rao Kulkarni, who was after me, and of course, Dr. Rupil and Dr. Devji Patil, I think, have recommended my name for this meet here. I must confess, I'm blessed to be in this serene, spiritual, serotonin charger atmosphere. You know, all of you look so peaceful, happy, compared to other places where we are all very stressed. So with this, I would like to start off with my presentation.
We have to increase the dose. We have to increase the number of tablets. Same thing here. We can't help. We have to start insulin. Started insulin also. Once she came in contact with our team in IIT Bombay, okay, now she is absolutely free of medicines. Can you believe? Anybody? She was taking 4 medicines. She will share her experience with insulin. Now absolutely free of medicines. Okay, so that she will share. So what I want to emphasize here is we are mentally fed with this information. These are chronic progressive diseases. Okay, that's already instilled in our mind. Once I get diabetes, it is a progressive disease. Definitely not. Okay, you can stop, you can reverse. Okay, so there is a reverse gear to this disease also. So we can definitely reverse. Unfortunately, this is very, very sad. In medical colleges, we do not teach the right medicine. Okay, I am boldly making this statement on the stage. Fine, and that is being recorded, and that is being, I think through YouTube, everybody is seeing. Some of the medical information is commercially controlled. Again, this is a bold statement. Some of the medical information is commercially controlled. So whatever is written in the textbooks, only that doctor will learn. Whatever is taught by the teachers, only that the doctor will learn. So the doctor has to practice what is taught to him or her. So we cannot find fault with the doctors. Why all doctors are prescribing a particular drug? Okay, because that is what is taught. That is what is written in the books. So we have to learn the art and science of critically evaluating the journal articles. Which journal article has to be accepted and which journal article, even though it is published in BMJ or Lancet or anywhere, I have to throw it in the dustbin. Okay? This skill we have to learn. Okay? And I told in front of Swami yesterday that we have made a beginning in our medical college. We are starting to teach our students the right medicine, particularly in such important diseases. So, but we tell the students, so you have to learn both the things because you have to pass the examination, right? The examiners read books. Examiners have not come to me to learn, okay, what is the right medicine. Fine, to become a good doctor is totally different. To pass the examination is totally different. So I am little critical, please excuse me, but sometimes bitter pills are necessary for good health. Thank you.
Okay, I'm going to share with you how difficult my journey was. I stand at 67.5 years in front of you to share my journey. Milestones of my type 2 diabetes mellitus. This happened when I turned 66 years on April 5th, 2023. And December 1994 was the doomsday when I was accidentally diagnosed as diabetic at the age of 37 years when I went to get the health insurance policy done. The world crashed under my feet. For a young physician with a sweet tooth, it was too difficult to accept the diagnosis of a multi-system chronic disease. Robbins' pathology describes this disease as a disease of triopathies with the denominator as vasculopathy. For non-doctors, you can lose your vision, you can have issues with your kidneys, you can have issues with your nervous system. Just as chronic diseases, acceptance of my fate was very difficult. Next one. Next one. The saga continues. In 1995, the search for a good diabetologist began. My father, late Dr. D.G. Venkappa, took me to a foreign returned diabetologist because he himself had returned to India after learning all about pediatrics. He's supposed to be the first qualified pediatrician of Karnataka and also, they say, the country. He got himself trained in UK in Great Ormond Street Hospital. And he felt that our physicians are not well trained, so we need to go to somebody who's trained in either UK or US. Never liked his attitude and taunt. Now we talk about so much of patient relationships, ATCOM module and all that we have, but his attitude was so discouraging. Meantime, I was running from physician to reproductive endocrinologist in India and abroad for my infertility. Those days, they diagnosed it as primary infertility. I'll share it as I go through. I was tortured with never-ending investigations and hormonal treatment for polycystic ovarian syndrome. This rude diabetologist had a dig at my weight and abdominal fat because at that time, we didn't know much about insulin resistance. Next one. From childhood, I've been a fitness freak. Played softball, cricket, swimming, walking and joined gym when gym started mushrooming in the city. I was just now telling Dr. Ambarao that I was along with Shanta Rangaswamy, we started the first women's cricket team in the state of Karnataka, and the whole women's cricket started with us. Despite this, no respite for my weight reduction. Even during COVID times, I was doing exercises in my balcony. The Leslie Sanson's YouTube videos, Walk at Home, helped me immensely. Don't think I just sat and ate. Note, I could lose only 3 to 5 kgs, and I was never, ever aware of insulin resistance. I want all of you to know that insulin resistance has become a pandemic, and it's your title, Save the Young Hearts. You're saving a diseased heart, but prevent that disease by the journey I have had, all the hastened deaths. I was called on many television channels to talk about it, but all the people were focusing on cholesterol, they were focusing on many other factors, and I said, I'm just going to talk parallel to them, and I don't want to come and create a controversy on the public media. I tolerated body shame from friends and families to the extent of suicide. My own mother used to tell me, you're so fat, you're so ugly, you're so horrible, stop eating. Next one. I'm a diabetic for 38 years. Drugs became a part of my life. Metformin, oral hypoglycemic agents, and statins. Strong family history of a coronary artery bypass graft and familial dyslipidemia. I also have bleeding diathesis, which was diagnosed by Dr. Sudharao in 1989, a renowned hematologist at Cook County Hospital, Chicago. So one more illness to my encyclopedia of ill health. You can imagine how it was for me. Every time I prick myself, there used to be blood hematomas in the subcutaneous tissue. Next one. Next slide. So Karnataka Institute of Diabetic Sciences was started. I was so happy. You know, good that we have such an institute in a government-run, unique super specialty hospital in the state. And that time I thought, okay, this is an entire institute devoted to, diabetes. So let me go there. See how we keep searching. Always searching for care, cure, and compassion, migrated to this place. It was a comprehensive care under one roof on OPD basis. Long queues and waiting was frustrating for me because it's the only center, 300 to 500 patients used to be standing in the queue. And I never take any preference by saying I'm a doctor and things like that. It was not any better. Here I was started on insulin, 11-11-11, which continued till 19 December 2022. No type of insulin was changed from isofane to Rhysodeg. Dose from 10 units to 30 units. And the third endocrinologist, a high-ended academician who was a chief endocrinologist of Mayo Clinic at USA, had lots of hopes, but was terribly disappointed. He was too scientific, endless investigation from macro to micro level. I get one investigation done, no, this is not enough. You get microalbuminuria. You do 24 hours, that, this, and all that. He was now the fourth endocrinologist who was a DM endocrinology from All India Institute of Medical Sciences. He was closer to my workplace, that is Bangalore Medical College, and easy to approach. I used to go during the lunch break. He treated my sugars very easily, callously, I must say, on a SMS and WhatsApp. Then, later WhatsApp came. And then he would say, your sugars are 200 now. From 10 units, you increase it to 15 units. You know, so callous. Insulin dose and drugs kept increasing, but no respite, either from blood glucose, drugs, or weight, or injections. The fifth endocrinologist, he's my classmate, a diabetologist who headed the redesignated KITS as Karnataka Institute of Endocrinology and Research. My happiness was boundless. He was very affectionate, asked me to eat 5 times a day. Kept increasing my insulin, which was very, very frustrating. 20th August 22, started developing bilateral dependent pedal edema, which was worrying me a lot. This was brushed off due to my long travel to college every day and my age. I kept talking to Dr. Asha, Dr. Anna Rao, all of you. Now, when people want to start a medical college, you need 199 acres of land. You can't get it in the city. We're all traveling for an hour, onward journey and return journey, and they just brushed it off. And I was worried. I always kept doing renal function test and liver function test myself, a doctor. And remember, I got a merit seat. I'm a gold medalist. And I knew something was wrong with me. But still, people, you know, you can't challenge your treating doctor. I used to find them normal. It is that raised ALT that started worrying me. I know that isolated ALT rise is an indication of metabolic dysfunction associated with steatotic liver disease, metabolic associated liver disease. Now it is redesignated, and liver not NASH, you know. We say no, non-alcoholic fatty liver, now they call it metabolic fatty liver. And liver ultrasound showed fatty liver grade 2. And people, you know, in our college, recently we had something, I'll just share if I have time. We had Dr. Roshni Sangania, who's a known international expert on low carbs and turnaround diabetes. And we asked a sonologist who come and say, I do 50 scans, minimum 30 are fatty liver. I never bothered about them. Till Dr. Asha told me that it is something to worry about. All this was passed off as aging and diabetes. October 14th was a devastating day in 2022. Lost my soulmate of 50 years, Dr. Chitra Narasimhan, who lost the battle to cancer. She's a fetal cardiologist. She was in Jaidava Institute of Cardiology, and we were all founders of the women's cricket team. I also had to take the toughest exam of my life, which is called Basic Course in Biomedical Research, Family Issues, Sleeplessness, and Escalating Depression. God knows what was happening to my sugars. I just want to see the photograph. On left side is Dr. Chitra Narasimhan. On the right side is another friend who's now suffering from bilateral CA of the breast. Well, my journey on health started on 1st November 2022. I was on the following medications. I was allowed my normal food for 3 days. Continuous glucose monitoring not only dictated me, but directed me towards my food habits. I kept having shocks after shocks. I was not eating right at all. I was told to eat ragi. And I thought ragi, all along I love ragi mudde, basar and dal and all that. And ragi mudde ragi showed me 400. And we belong to Bijapur. I was just now telling, sir, we like jolud roti and engai palya. When I ate jolud roti, 300, 350. What was happening? How come I'm still alive? Okay, I take sessions called Are We Eating Right? Gift of my life from Dr. Rupal, most of you know her, arrived in the form of CGM and 4 sensors. She somehow had to get me onto the low carbs movement, and she worked very heavily on my diabetes reversal. Couldn't use them immediately with exams round the corner, stress and emotions, and I didn't know how to use it. I admit, I didn't know how to use it. I walked around flaunting it for 4 days, then went through the videos on appropriate use. The journey to LCHF began. Not a ovo-vegetarian, but I learned the importance of eggs, a complete protein with 9 essential amino acids and 39 nutrients. If you add vitamins, lemon, it becomes 40 nutrients. Eggs became a part of my diet from 3rd November 2022. From November 4th, started reducing insulin while on oral hypoglycemic drugs. Remember, now I had reached 70 units of insulin. 70 units, which is deadly, okay? Started magnesium glycinate. Now the dilemma. My classmate Endo just was not reachable and became incommunicado because he didn't know anything about all this, and he was feeling a little scared that I have embarked on a journey of this while he was all the time telling me eat 5 times, increase insulin dose. It was a milestone day, 19 December 2022. Rupal was in Kenya, holidaying. And the day I stopped insulin after 12 years. 12 years of insulin. You know, I'll show you the pictures. This fat is not reduced. The place where I pricked, every needle that I went, every fat cell there is hypertrophied. We had a lot of arguments. And then we sent a mail to Ben Bickman, the author of Why We Fall Sick, and he's the one who's done enormous research on insulin. He said, the place where you are pricked, that will never go, okay? Insulin got phased out. I was on low carbs, high fat entered my life. The transition wasn't smooth. You know, you're on high carbs and you're coming to low carbs. You have stopped insulin. You can imagine my dilemma. Too much of confusion and ignorance from endos and physicians. Meantime, Rupal was holidaying with her family now in Mexico. We were in different time zones. I panicked. My morning sugars rose and kept having hypo. Now you all know that when you are on low carbs, when you're trying to go off, fasting, morning sugars are high because there is low insulin at that time. Student endo comes to my rescue. Just imagine, I don't have Rupal here. I don't know whom to contact. Any of the endocrinologists says, are you stupid? Why did you stop insulin? Which fool told you to stop insulin? We don't know anything about do what you like. I was just washed off. Okay? I was thinking I'm going to die today. He frankly admitted that he's unaware of low carbs and high fats. But at least he was a balm to my heart. He at least guided me and was an emotional balm. He was doing his DM endocrinology in Calcutta. Enter one more endo who felt I should stop insulin. That's the day I stopped, December 19, 2022, and gave me a more potent oral hypoglycemic agent like GP3 and Vagabelis. The hypoattacks were dreadful, scary, and unmanageable. I've gone to 45, 40, and I've survived to teach you all my journey. Then comes my endo, another endo. I have lost count. And on 1st February 2023, I was under the care of an app-based endo. No human touch. For 15 minutes, online consultation, it is 5,000. Okay, or you enroll a program of 3 months, it is 1 lakh. Okay, Rupil said, Asha ma'am, I'm so emotionally attached. I think we will take up this. If you don't mind, I'll pay. I said, nothing doing. But blissfully, even that, we have to put everything on the app. They chuck on the app, and then they come back to you and tell you, reduce your this, reduce your that, increase your exercise. But blissfully and continuously monitored by Rupil and CGM. You need that emotional support. I feel very sad when I go to the gym, people are having the Bluetooth. When you go for conferences, people are having the Bluetooth. And when I'm sitting, I was trying to make friends. Everybody is busy looking into their mobile. I put my mobile inside and started having a lot of mess. So let's detox ourselves. Let's have that human touch. You need it. We are desperate. Loneliness is killing us. There was something was saying, we are, the family ties are vanishing family ties. We're not bothered. We are very selfish. Bahut tez mein hai. We want to be very fast in everything. And the mishaps. In my 30 years of diabetes journey, none of the endos asked for fasting insulin, C-peptide levels, coronary artery calcification score, fatty liver was treated with triviality. Okay? And after 3 months of low carbs and high fat, I'm off all drugs, 2 grams of metformin, magnesium glycinate. Thyroxine is also tapered off. I'm on triple fish capsule because I don't eat fish. I have to protect my heart. My weight at the end of 3 months from 84 to 71 kgs. 13 kgs in just 3 months. And my blood pressure, look at my waist, and my HbA1c, my journey with diabetes. This particular photograph was taken by a friend just to body shame me. And it is a nice document. It's good. She took this and she put it up in our groups and said, look at Asha's tummy. How people insult you. This was an illness I had, I say. And look at, Rupila was very particular that I come and address you because I don't care showing you my body parts. Look at that in just 3 months, what has happened. Look at the way insulin causes lipogenesis and put fat. I had so much of visceral fat, okay? And that was November 22, and that's November 23. 1 year later, I lost 25 kgs and 10 inches of my waist, I think. Everything has been documented. And turn around diabetes, they have a video course which is 18,000 rupees. And that person who wrote this, she wanted my permission. I said, do what you like. I'm not an youngster where some guy is going to come and rape me or taunt me. If the world is going to change with my story, please take it. Okay, this is there on Amazon, etc. And these are things. So again, I'm sharing what happened. And people kept telling me that I should color my hair. I'm 67 and a half. I don't want another endocrine disruptor. People who color their hair. It will be here, back. I want to age gracefully. Okay, in some, I hope I win that award. I've been called for a competition called Style Icon. I'll be participating in that. No one treated me. Everyone treated my glucose. Increased insulin and drugged me. Never addressed my disease, nor my mental state. I lost my father, to whom I was very attached. I used to call him Appaji, 2016. I lost him. And the whole world came crack down. On October on March 23rd, 2019, I had attempted suicide. It is because of insulin resistance. Now in our hospital, the psychiatrist does evaluation for insulin resistance. And he says, Asha ma'am, you're right. This is a major cause for depression. Okay? No one knew about low carbs and high fat. Rupal is somewhere and everybody is saying, what nonsense, you're getting guided by somebody on WhatsApp and emails and all that. Is this how a physician treats you? I said, what about the physician who's just drugging me? And continuous glucose monitor, not many are aware. Now, in the past 2 years, it's becoming very popular. Please, physicians, heal thyself before you heal others. You know, we should update. CBME curriculum says we are lifelong learners. Recently, AI, artificial intelligence, is coming in a big way. I have done a lot of artificial intelligence courses. I can even start being a faculty for that. Okay, these are my objective evidences of what has happened to me. In which program can you lose? I've forgotten to put that. This thing, waist was 49 inches, and today it is 39 inches. I'm sorry, weight was 95, 80, weight, I've interchanged the date. Weight should have come there, 85 kgs, and inches was 49. And I have reversed grade 3, grade 2 fatty liver, which is impossible. Okay? You ask anybody, you can never reverse your fatty liver from grade 2 to normal. I was a victim of the ignorant physicians and endos. We diabetics need constant supervision, care, and compassion, especially the mental health. Please create a group of people who can help us. Maybe we'll have helplines. I'm one of the global founders of Lactation Helpline way back in 2005 and got many awards for it. Think of helplines. For many are having insulin resistance, diabetes. Let us collectively fight the insulin, statin, and pharma mafia. They want you to be sick so that their products sell. We live in a world where profits before health and not health before profits. Nobody is bothered about your health, I say. Isn't my journey an eye-opener? And how badly I have been wounded until an angel entered my life, Rupal the healer. For reversal and insulin resistance, the way forward, it's a long road, but it's worth it. You have to prioritize your proteins. Okay, I eat 90 grams of protein. We are all hypoproteinemia or malnourished, protein malnutrition. All of us are only on 0.5 grams of protein, where the requirement is 1.2 grams, ideal body weight. Build muscles, because that's another source for glucose to go away from your body. Yes, tough journey needs immense dedication, determination, monitoring, and support. Learned a lot, and I'm still learning. And these are my biochemical values, how it has changed. And C-peptide, you know, nobody asked for C-peptide. And at one point of my C-peptide was coming down. I had to aggressively do something. In 1 week, I have done 48 hours of fasting and 36 hours of fasting. That means to say 3.5 days in a week I have fasted. I have done this for 6 months. People kept telling me, you'll die. But I want to be around because still breastfeeding becomes 100%. That's what Rupal says, you should be around, okay? And this is among the many people who have reverse diabetes. I don't want to call it reverse diabetes, reversing my insulin resistance. We are some of the people, it had come out in all the national papers. And this is, again, just to tell you how I built my muscles and what is happening, okay? And look at this. Yesterday, a day before yesterday, I presented a paper which I'm going to call the cheek pinch sign. I'm going to use Harbinger calipers, and I'm going to correlate it with fasting insulin, HbA1c, and HOMO-IR, FBS, and see how best. In a community, Devji Patil, you have all met, you have heard about him. In a community, he throws the tape and asks them to measure the biggest part of their abdomen with an inch tape. And then he says, 2 times that. If my 35 inches into 35, it is 70 inches. He says, put it on your thing and see. If that inches is above your height, then you have insulin resistance. So I want to develop a community program where you pinch and see what it is. Okay, it's the study has just begun, because when I saw this, my God, look at my cheeks, look at my, fat below the chin and all that. Okay, and again, Rupal wanted me to say the sustenance. This is how in the black saree, April 25th, 2023, it's my birthday, 24, 25. I've sustained the low carbs. People will tell you, you can't do it. You'll feel like eating, you'll have craving. Then they wanted a side pose. Okay, I'm supposed to be one of those few people who have chronicled everything with photographs. Thanks to Dr. Rupal, we never knew that this is going to happen. Look at my cheek. Okay, there's no pointer in this. Look at my cheek. It is not because I ate. It is because of insulin resistance. It is because of the way I was loaded with insulin. And this is before, after, and what a journey it was. A Journey Through Life and Poetry is a fabulous book which you should write. So ladies, gentlemen, Seva people, I want all of you to get into the path of health. Nobody believes. People want me to put color, and they say you look 40, 42. Who's interested? I want to live till I can make all of you, healthy population. And when I look at your reference ranges, they say metabolic health. When you look at the reference ranges, it is not the reference range from healthy people. It is from metabolically unhealthy people. Now the globe is trying to do a healthy reference range. 95% of the population are metabolically unhealthy. The parameters given by Dr. Rupal is from healthy population. So people look at it, no, it says 6.5. My HbA1c is 6.5, the range says 6.5. And then, when you look at it, it is 5.3. Actually, it should be 5.3. Don't look at those ranges, please. I'm willing to share with sir whatever the ideal things are. Okay? And in our hospital, I made simple programs where they eat their right amount of protein and 3 meals. In between, you don't have. Sir was saying, shall we have it? After refreshments, before refreshments, I really get very panicky. Now I'm almost into 24 hours fasting. Okay? And I'm planning to fast till tomorrow morning. See, do I look like I'm fasting? Okay? And remember, you have to drink lots of water and order of eating. I'm sorry, I saw the food that was being served. It was high on carbs. Even the red rice, you agree, whatever rice is rice. It is a very rich source of carbohydrates. Then the dals, then I saw some aloo ka thing. Then there was drumstick. Of course, curds and buttermilk. And people did eat Mysore pak. Okay? So, why are we so tempted? I say, zip up your mouth, I say, if you want to be healthy. You open the zip in the morning, if you want to have it. People say, my husband, madam, before he goes for a walk, he'll say, I want a coffee. Then he comes back from coffee. Then he has his breakfast, then he'll go for his bath, again coffee. Then breakfast, again coffee. 11:30, coffee. 1:30, a big lunch. Then at 3:30, coffee. Then he comes home in the evening at 5:30, coffee with biscuits. Then we have dinner at 9:30. Again something. How many times you are eating? Each time you eat, your insulin spikes. So gather your food and eat at once. Just doing that 3 times, getting the right carbs and the order of eating. It should be proteins first, vegetables like that. Okay? Never ever look at the mobile when you are eating. A new concept is coming. It is called mindful eating. Why do you want all these westernized concepts? We were all doing it together. When you're eating, also you're looking into the mobile. At least when you're eating, please be conscious of what you're eating. Okay? I'm extremely sorry about the confusion with the PPTs, etc. Thank you very much for giving me a golden opportunity.
Thank you so much, Dr. Asha, for so honestly and unabashedly sharing your journey with all of us. I think it was a great learning experience for all our students and everyone present here. I request Dr. Pooja to hand over a token of our appreciation and gratitude. Thank you. We will have a short break now. We can finish the coffee and refreshments outside, and we'll resume the session post the break for the last concluding session. I assure you that's the last one. So we can please proceed outside and can take refreshments and return soon. As part of the concluding session, we have Dr. Praveen Saxena, Dr. Anna Rao, Dr. Anand Agarwal, Dr. Sushil Sharma, and Mrs. Vidya Vijayasai. They will quickly recapitulate our learnings over the last 2 days, and reiterate the key takeaways so that we can implement them in our daily life and strive for a healthy heart and a happy life. Over to Dr. Agarwal.
Sai Ram, good evening to all of you. We won't take much time, and hopefully we'll make it a bit interesting because it's a concluding session. Most of you will be eager to go and finish off. So in the beginning, I would give a chance to the audience. Can I invite one from the ladies' side? You can come and give your views of what you learned in the conference and what you think, apart from what you learned, is there anything else you can add from your side? Anyone, one lady, one can come and just give your views. Any volunteer, please? Quickly. Sister Shantani? Yeah. Someone from this side, get ready. The moment she finishes, yeah.
What was the question again? What was the question again?
You can
Feedback, what you felt about
or anything which you like to add about this concept.
All right. Okay, Saram, everyone. Actually, I found the conference very, very interesting. I learned more than I thought I knew about heart disease, so that was good. I like the practical tips, whether it's about diet, whether it's about having adequate sleep and discipline in terms of meal times. I like particularly the nutritionist segment, where they made the whole topic around how you fill and proportion your plate very well. So that was actually quite excellent. Speakers, obviously very, very competent. So really, I thank all of them for actually taking the time to come here and share their expertise with us. Truly appreciate that. I don't know whether there's anything additional that I can add. It seemed quite comprehensive. I liked both Dr. Raghupati and Anna's, Uncle Narasimha Murthy's also sharing, because the spiritual aspect is very key. And I think probably that's the unique aspect of this conference, because we talk about the spiritual aspect and how it all ties in with everything that we do. So that would be all I would like to share.
Sister, if we want to do this conference again here or somewhere else, would you like any modification, anything more you would like to be addressed as a common layperson?
Okay. I do feel that perhaps for most people, 2 days may be a bit long. So perhaps a shorter conference would be better. And because the content is so good, I think maybe we want to consider doing road shows to bring the message out to where the people are. Although this is a beautiful place, it's not so easy to come.
What would be your suggestion? If you want us to do road shows, in what way do you think we can reach out to the public?
I guess you've got to look at your audience, whether you're talking about the working group set of people. You could also talk about institutions and the youngsters, because what I'm learning from the conference is a lot of this, you have to learn younger the better, because then you actually build in better habits. And so maybe the institutions, the universities or whatever, and we can go to them and share with them some of this. So we'll have to curate the content depending on the audience and where you're going.
Fantastic, Sister. Thank you very much.
Thank you
for the comments. Anyone from the gent side? One person? 2 to 3 minutes comments, please.
अखंडमंडलाकारं व्याप्तं येन चराचरं तत्पदं दर्शितं येन तस्मै श्री गुरवे नमः. The people who are sitting on this stage are, according to me, the gurus, because they showed us the inside of the heart, the outside of the heart. It was not like the normal conferences that happen in every medical college or medical conferences. Rather, it was more like, I use an idiom to make people understand. There is an ice. There is ice and there is a sight. We here did not talk just about the ice. We talked about the sight as well. Where is the sight coming from? It is from the within, the spiritual aspect of it. And the doctors here have enlightened us about what is the problem, how the problems appear, what are the things that we are supposed to do so that we stay away from the problems, and what are the things that we should do if we have the problems. These are the 4 aspects which we have to know as general population, and there is nothing we can add or nothing we can take off from this. The only thing I would suggest to the panel is to give more time to the doctors to talk about these kind of things on a technical level, because we will be waiting to listen to more so that we will be able to understand things better so that we can explain it better, is what I suggest, sir. Thank you so much.
Thank you. So to the panel, I'll be putting some specific question to specific panelists for few things which I thought were not covered. See, our body is 70% water, and there is a lot of buzz around alkaline water and things like that. So Dr. Praveen Saxena does a lot of work in toxicology, heavy metals and everything. And as he elucidated in the morning, there is a lot of water, food, environmental pollution, which there is no choice but for us to be a part of it. And all that pollution, toxic metals, heavy metals are becoming a part of our body. So I just want Praveen to be specific and answer me the question about what are his views on alkaline water.
Thanks, Dr. Anand. I think I'm going to give you a small thing for everyone. Let's not get only diverted by alkaline water and other things and all that. What is the way forward? I accept there is a toxicity, I accept there is a thing, but there are some simple ways you can starting from today itself. What you are going to do is take a water bottle, which is glass water bottle, okay, 1 liter water bottle. Fill the water, whatever you are. I prefer usually people having something like Matti Kunda is called the clay pots. Boil the water. Once you boil the water, all microplastics will be gone. After that, put in that clay this one. The next part will be fill up in that glass bottle, keep in the sunlight for not less than 2 hours. This water becomes something like structured water. The pH, all things, this gets synergy. Yes, for the people who can afford alkaline water is because what happens is that the pH of water is the one thing which is, we know Coke has got pH of less than 3, 4 and all that. The pH of 7 is normal water. Now, because of some reasons, our pH of water also is getting lower because of toxicities and all that. And if I am able to keep the water at 8, pH is from 0 to 14, mid part is 7.2 to 7.35 is the normal which is said. If you are able to make it towards 8, don't go towards 9, don't go towards 10, your bones are going to take a beating out of that. 8, very, But again, I must emphasize, there is not a simple one dot answer for that. You have to, this is water, whatever we are taking now with RO water, we keep taking that something like filter. After that, we didn't even bother to add something like good minerals like magnesium, calcium. You take the sea salt, add a pinch of sea salt into that water bottle, which you are going to keep in the sunlight, and see the results. The proof of pudding is in the eating. You can easily do that. See the changes what you get. And yes, I think, Anand, this is what I can tell you about water. You can always implement immediately.
Actually, Praveen, you have touched on one more important point. Apart from the alkalinity, you talked about the structure of the water. It's a big subject in itself. So what Dr. Praveen was saying, that keeping the water in sunlight, it is a very important thing. And the people are doing a lot of, even marketing agencies, they are saying, you use this crystal, you run it through the water will become structured. Because see, we have to understand one thing very clearly. I don't think many of us drink enough water. We are not conscious because we are in workplace and all that stuff. So I think a normal adult, during a day, minimum 2.5 to 3 liters of water, consciously you have to drink. So that is one thing.
There is one more simple marker I told in this also. If your urine color is white, in the sense colorless, then you are drinking enough water. If it is colored, it is becoming yellow, you are dehydrated. You need more kind of stuff.
So I think, Praveen, we have to actually address this. Maybe we can write an article, maybe we can through all this thing about demineralization of water through the RO system and all the pollutions and all, how to lead it and all. We'll have a further discussion. To Annarao sir, if I were to ask you, what was the one takeaway from this conference, most important takeaway, what would you say?
I'll come to one most important takeaway little later, but I think most important thing which is missed, or maybe it has come in bits and pieces, is that we are all testing for our health checkup every year, and everybody says, okay, your reports are normal, and we are happy. Okay, every year, this is what happened to me 9 years back. Every year I was checking, they said normal. One fine morning they said, you have hypertension. I said, how? So many years I was doing everything and they said normal. Suddenly, okay, that means every year I check my blood sugar, they say normal. And one day they say, you have got diabetes. That means we are waiting for the patient to develop diabetes and then say you have got diabetes. There is nothing called normal. Don't accept normal reports. Okay, this is my advice to everybody. There is nothing normal. For example, my blood sugar is normal. We never check the insulin level. Fasting insulin is the most important test that we have to do, and nobody does. How many of you have done fasting insulin? Nobody. Okay? Why? Because doctors don't do that. And in fact, the American Diabetic Association specifically prescribed, don't do fasting insulin. Instead of telling do insulin, they're telling don't do fasting insulin. Okay, I don't want to go into the reasons. Okay, so why I want, if your blood sugar is normal, why it is normal? It is like the fasting insulin may be 10 times more, it has brought the blood sugar to normal. That is a metabolic disorder already. It is like a work can be done by one person and that person is not doing the work. And you employ 10 people and the work is done efficiently. Now you say work is done efficiently. But 10 people, for one person's work, you have employed. That is what is happening with insulin. 10 times more insulin, and insulin is good as well as bad. So more insulin is definitely bad. Therefore, you must test your insulin every year. You don't check anything else. Check only insulin. And normal insulin should be single digit. Okay? If it is more than 9, absolutely it is metabolic syndrome. 6 is okay, fine. See, 6 is 2. In fact, 2. We recommend 2. Okay? 2, 6, but single digit at least you aim. Second, I told, why normal we should not accept, sir? Because so many people, even here also, so many people are showing me their reports. Everything is normal. HDL, normal. LDL, normal. Triglyceride, normal. Okay, what does that mean? Nothing. Total cholesterol is absolutely useless. Don't read total cholesterol at all. Because my HDL may be 80 and my LDL may be 120. How much is the total cholesterol? 200. That is the limit. Okay, so you start worrying, or if it is 122, 123, still it is normal, LDL, and my HDL is very good. The major component of the good cholesterol, total cholesterol, may be HDL. There are so many components in total cholesterol, so it's absolutely useless. LDL cholesterol, I'm not making a general statement. Majority of the doctors depend on the LDL number. And if the LDL number is above what is the reference range, they think of starting statin. Okay? Absolutely not required. For primary prevention, statins have no role. Only for secondary prevention, that means if you had a heart attack, okay, you want to prevent a second heart attack, only then statins are useful. Okay? Unless there are certain exceptions, we will not talk about that. Generally, okay, statins are not required for primary prevention. Okay, that is one thing. Triglycerides are more important than LDL cholesterol. So look at triglyceride. If the triglyceride is high, then you have to worry about your lipid profile. Unfortunately, we are not teaching lipidology in medical colleges. Now there is a time, because non-communicable diseases are so much more than the communicable diseases. Lipidology and how to read this lipid profile has to be taught in the medical colleges correctly. Okay? If the triglycerides are high, in LDL there are two types of LDL. One is large, fluffy LDL, which is absolutely harmless. And 80% of the LDL is made up of this absolutely harmless LDL. Only 20% of the LDL, in a normal person I'm talking about, 20% of the LDL is called as small, dense LDL. This small, dense LDL is harmful. Okay? So, but if your triglyceride is high, then the proportion of small, dense LDL is high. Only then your LDL number is little worrisome. Therefore, ultimately what I want to say is, we are not interested in numbers. We are interested only in the whole person. Okay? We must be talking about the health of the whole person, and there are a lot of disadvantages or side effects of statins which nobody talks about. Okay? So for no reason you start statin, and then you end up with so many side effects of statins, so that is not to be practiced. Yes, definitely there is a role. Hardly 10% of people require statins, but it is the largest sold medicine in the world. Okay? Largest sold medicine in the world is statin. That is one thing I want to tell you. Second important thing is, in India, the statistic says 25% of the people are obese or overweight. 75% of people are normal weight. Okay? Out of this 25% who are obese or overweight, 75% people have metabolic disorder. You understand? 75% of 25%. Okay? And the 75% who are normal weight, 40% of those are having metabolic problems. So 40% of 75% is definitely much more than 75% of 25%. So we are only interested in obese people. Normal weight people, we are not bothered. Okay? Therefore, TOFI is very, very common in India. So we have to worry about TOFI. So particularly, if your belt size is more, okay, then you know abdominal obesity. Your dress size is more, you know your subcutaneous fat. But liver fat is there, nobody knows how to understand that. So therefore, we must, and insulin is the best indicator. Okay, insulin is a cause of liver fat. Non-alcoholic fatty liver disease is because of insulin, insulin resistance. So insulin, insulin, insulin. Please check insulin. Thank you.
So people were interested in statins without, I do not want.
Because what applies is, when we don't take statin, we need to answer to the patient, and we have a Ayurvedic dynamic doctor, we were discussing about something on using something like Triphala. I have
think
seen in Kansas, Triphala is working well.
Praveen, we'll not go into research. We'll just stick to certain things. So the thing is, see, there is a lot of, I prescribe statins every day because after bypass surgery, we are bound to prescribe because it's shown in the trials that it prevents the progression of atherogenesis, not even in the native arteries, in the grafts what we have done. So Dr. Anna Rao sir has given his views that what he said is, it is not useful for primary prevention, only in secondary prevention he uses. So I just want a small comment from, maybe we need to have a big scientific debate and all, and this is not a forum. We are just discussing about prevention of heart disease in the young people. But a small comment from Dr. Sushil Sharma ji about what his views on the statins.
So I'm going to digress, okay? Let me tell you. Game, set, and match to you. Okay, so that ends the cholesterol debate. I feel like you have been coming here to this conference for 2 days, and so intently you listen, and I feel like I did not give you much of the practical that I do in my program. So I thought I'll give this to you. I'll share with you the most important practice for lifestyle transformation that I use with my people that attend my program. And I'll do it with you today, okay? And I'll tell you how it works. If you saw my presentation, you saw that lifestyle transformation needs mind transformation. There are only 2 things that change your mind: the divine grace and self-grace. Guru, Ishwar Kripa, ya Atma Kripa. So I'll tell you how to get this divine grace. Obviously, you're here for divine grace. Atma grace ke liye, I'll tell you what is the simplest way. So I want to do a practice with you. I want you all to sit straight. It's just 1 minute practice, okay? Just sit straight. When you do it at home, remember you follow 3S, and the 3S are stillness, silence, solitude. Find a place which is sacrosanct, preferably your shrine room, in front of your Guru, Ishta. Sit there. Sit straight. Make sure that you'll sit still for whatever minute. Today we'll do it for only 1 minute because time is short. And silence. And I'll tell you how to get silence. All outside things should be silenced. Quiet room. Turn off your phone. And nobody should call you. Second prerequisite is 2 chosen times, either 6 a.m. or 6 p.m., 5 a.m. or 5 p.m., 7 a.m. or 7 p.m. You choose those 2 times, okay? So that's the second requirement. And I'll explain to you why, the scientific basis. The third thing is, you are going to stay focused on your breath. Right now, I want you all to breathe normally, okay? When you breathe normally, there's one thing you can all experience, and that is, when you breathe in, when you breathe out, the breath going in is cold and the breath coming out is warm. Everybody can experience that right now, right? So that one sensation, one experience, you'll stay on that, on your breath. Breath goes in, breath comes out. What is mind going to do? Mind is going to wander. That is the dharma of mind, to wander. Let it wander. You are a sun, okay? You're a sun shining. A cloud comes in front. We don't see the sunshine. Cloud moves away, okay? So this is how you're going to look at thoughts, feelings, sensations. They're clouds. They come and they move away. You don't invite them. You don't reject them. Don't contrive your breath, normal in, normal out. Feel the cold air going in, warm air coming out. Thoughts come, let them go. You stay on the breath. Don't force them, but at the same time, don't get attached to them. And we'll do that for 1 minute, and then I'll explain you the benefit. We don't need clock. I'll tell you exactly when 1 minute is. So we start the practice now. You can open your eyes. Okay, so the scientific basis is this. To transform your life, you need mind transformation. For mind transformation, you need intrinsic motivation and self-control. This practice gives you 3 ends: niyamit, niyantrit, nirdharit. Your life becomes disciplined, it becomes measured, okay? And it becomes regulated through this practice. So what happens is you did this, now you have picked up time, 6 a.m., 6 p.m. Come what may, you don't change your time. When you don't change this time, you realize that lifestyle change is the priority of my life. Everything else is on the wayside. That is when lifestyle changes. Why is it that Buddha had to sit under the tree for days on end? Because he knew that is one thing I need, and he got it. But I'm only asking you 2 minutes. So 1 minute, you centered on the breath. 2nd minute, you reflect. Today, I'm going to make one change in my life. Let's say in our program, we say on day 1, we change the breakfast. And what is the breakfast? Fruits for breakfast, sprouted grains, and almonds or walnuts, 7. This is the breakfast. I'm going to eat this today, and I'm going to eat it for 7 days. So that is what you reflected on. At the end of the day, you again reflect after this first minute. Did I do it or not do it? If I didn't do it, I forgive myself. I'll do it better tomorrow. Simple. You do that for 1 month. Now, this is both diagnostic and therapeutic. If you cannot do it for more than 2 days, you know that at this present state of mind, you cannot transform your life. Your mind is very diffracted, and it is running in many different directions. You need to wait. Number 2 is, if you did this, fighting your mind, then your resolve to change your lifestyle will increase, and that's how lifestyle changes. So all the things that I discussed with you, although we do it in 2 weeks, 3 months program, personally it took me 3 years. Every practice that I use in my program, I did it on myself first, and it took me 3 years to change my life. So if you can do this reflection practice at a fixed time, twice a day, and if you did it for a month, the world is yours.
I think you dodged the question on statin, Dr. Sharma. You dodged the question on statin. Okay, I think let it be. Let it be. Sister Vidya, I was, throughout your program, yours and Brother Vijay, you talked about the soft copy of the heart. And brothers and sisters, for me, it was a eureka moment. I'm seeing all around people dying in their 20s and 30s. Most of them do not have any documented risk factors. So I was telling subconscious stress, all the things I was telling, but I did not have the clarity with which they explained about the heart chakra and the soft copy. We all know that we are energy first, and this body is a manifestation. There is a subtle body and the gross body. So the gross body is a manifestation of the subtle body. Maybe the way I am telling may not be the exact way, but grossly. So I want you to just dilate on that. You said the soft copy of the heart, the energies are disturbed there, and suddenly it appears in your coronary arteries, blockages, or whatever happens. Thank you.
Thank you, sir. With the kind of cases we receive and the kind of people come to us for many, many issues, mainly teenage issues. These are all more to do with one thing is there are issues with parenting, there are issues with food intake, there are issues with the freedom they have to use television or phone or whatever. There is no strict time for it. Anytime they want, how much ever they want, they can use it, and most of the time parents also support that. So with all these things, when they have certain issues, some issues that they're not able to express, you can't run to the parents. Most of the parents are close to hear what the child is going through. At the same time, you can't share it with your friends. If you share it with your friends, you get into wrong companies. With all these things, so many things are kept within. So many things, so many feelings, so many thoughts, so many confusions, especially from the age 8 to 14 is the critical period where the feeling realm starts, and that continues after that. So many changes in the body happens, and they can't run to anybody and speak about it freely. When they don't find anybody, the best part is just to have a counselor. Find a counselor, go talk about it, bring your burden down. Somebody is not going to judge you, bring it down so that your heart is going to be lightened. Whereas if we continue to carry it, naturally it's going to build up every time we experience. It's almost like I have a small issue. There are many more other experiences. It makes it slightly a bigger issue. Then you leave it for a while. Many more experiences will be added to it. That becomes a bigger issue which will start showing up on the body. Then it becomes irreversible. Then anything you do with yourself, with your mind, and try to change your mind, it will take as much time it took for it to manifest, that much time it will take for it to go also. So keeping all these things in mind, I think younger generation should be open to talk to somebody. You don't have to go to a professional. Have a good friend. Speak to your friend. Make sure that the friend is not going to speak something behind your back. Go talk confidently. Say what you want to say. Express what you're going through. That is one way of really lightening your heart. And the second thing is, if you don't have somebody like that, go to a professional. Even that is not a possibility. The first and the foremost thing is to build a kind of relationship with your parents where you can confidently go and say anything and everything that's happening in your life. If that door is open, nothing else you need. If that is not a possibility, and all these other things are other options. Of course, once you go speak and lighten your heart, you will also get to see what are the other things you can work on, whether it is food habits to be changed, or it's the time that you spend on social media, or how to really work with your anxiety, fear, or pain, or rejection, whatever it is. A simple tool. Yesterday we did Ho'oponopono. There are so many things you can just the way Sir said, you close your eyes, breathe, focus on the pain that you're experiencing or rejection you're experiencing, and just through breath release that particular feeling. You breathe for 10 minutes, focusing on that particular emotion. Through breath, you can do so many things. You can release it in no time. Even if you go to a counselor or a therapist, they ask you to focus on your breath. Through your breath, they ask you to release these emotions. And so many things you can do just by focusing on your own, energy. So these are, like the moment you start, feeling free to say what you're going through, expressing what you're going through without any hesitation, I think that's the best way for you to focus mainly on your heart chakra being the bridge from the lower and the higher the chakras. And once the heart expansion happens, you truly stop judging things that are happening around. You really start seeing life around you. And a dry tree, a dry leaf, everything looks so full of life. Nothing around you is, something that you need not fall in love with or should not fall in love with. Everything around you looks so beautiful. And we start really, even if there is a toughest situation around, you start focusing on yourself. What is my contribution? Is there some way I can change? I can bring certain changes within me so that the relationship is going to change or the situation is going to change. So, based on the kind of work I do, I can only speak about. I think one thing is to feel free to speak about your issues. Just the way there is an issue, we run to the doctor and we don't find it tough to tell the doctor, this is the issue I'm going through. Similarly, when it comes to mental health, we don't want to go to the doctor or we don't want to go to a counselor who can help us easily. We don't want to say because it's something that people should not know or the society should not know. So we keep it within ourselves until it becomes a massive issue. So with this, with all the things that we have learned since yesterday, whether it's changing lifestyle, meditating, focusing on breath, and accepting myself, liking myself, loving myself truly, bringing in so many changes on daily basis, the way I look at things or the way I see things, and taking responsibility for where I am, what I'm going through. If these are certain things that we focus on, I think world within me and world around me will beautifully change. The moment I change, I will only see good things around me. Once my heart expansion happens, energy, heart chakra expands, I can only see good things around me. People who are truly enemies who come to me, I can only see the good things in them. World looks beautiful. Once the inner world looks beautiful, external world also looks beautiful, and the people and situations that are going to come, that are going to come into my life, will also look beautiful. And with this, I can say, especially youngsters, I know it's tough, but take charge of your life. Focus on your emotions. That's very, very important.
Thank you so much, sister. The point to take away from the sister's last statement, what we perceive or see outside, it's just a reflection of what we are inside. And I always say, I do not have control on my outside circumstances. I do not have control on others' mind. The only person whom we can change is ourselves, so we have to change ourselves. I'm just going to make final 2-3 comments and then we'll close. When we think of heart, what emotion comes to us? Happiness, love. I think the most important thing for us in life is to be happy. When you are in that state of mind, all other emotions and negativities will come down. Because you cannot have negative emotions when you are in a state of love and happiness. So I think that is one thing. And I always say, celebration of being alive. Because I see life and death so closely. Sharma ji, when you are doing a coronary angioplasty, left main angioplasty, what is the biggest size of your left main, sir? Maybe 4 millimeter in Caucasians? So, when people take pride in saying, I am this, that, so many things, I say, Bhaiya, your life is hitched to that 3 millimeter hole. So many times, Sharma ji has done emergency left main angioplasty. So many times have operated on patient with left main disease and saved. So many times I have just seen the patient in CCU. I said, I will schedule the patient tomorrow. The moment I come to the OPD, I get a news the patient is infarcting. I have to rush him to the theater. So the life, we are hanging with a small thread. So just celebration of being alive. Every moment we are there, just take it as a grace. I'm telling you guys, I'm telling you a practical experience which I myself had. I had a trimalleolar fracture of the ankle last November, 2 days before Bhagwan's birthday. I wasn't able to go to my bathroom. That was like climbing a Mount Everest. So now, even though I have a little bit of limp, taking every step is like heaven for me, because I wasn't able to take a step without a support. So same thing, your heart is beating, you don't have chest pain, you don't have shortness of breath, you don't have pedal edema. Just be happy about it, And just by being happy. And I'll just conclude with this shloka of Isha Upanishad. Purnamidam Purnamada Purnat Purnamudachyate Purnasya Purnamadaya Purnameva Vashishyate. What it says is, everything is complete. I am full myself. There is nothing for me to desire in the life. So the whole struggle of our life is in desiring, seeing that this name, fame, this object I'll get, it will make me happy. But it is not so. So you be happy within yourself, and I think that will save most of your heart blockages. So Jai Sai Ram, I conclude with that statement, and I'll request my good friend, Dr. Ramohan, who was like my brother in this whole journey. He stood shoulder to shoulder and to give the vote of thanks. Thank you.
Om Sri Sai Ram. Offering my pranams and sincere thanks to our beloved Sadguru Sri Matsudan Sai for providing us the platform to discuss and deliberate the pressing issue of saving the young from heart ailments. I would like to express my sincere appreciation to all the speakers and delegates who have made this event possible. Your expertise, insights, and hard work have been invaluable and grateful for your participation. Special thanks to Ms. Sheila Avath, Ms. Vidya Sai and Vijay Sai for taking this conference to a different level. Last but not least, a special thanks to audiovisual team, Brother Ravi with his kitchen team, all volunteers for their unwavering support in the last 2 days. Thank you so much. Jai Sai Ram.
To Mahesh Bhai, Suresh Bhai, who have been there with me a long time in this concept of Save the Young Heart. They are busy entrepreneurs. They have taken all the time off from their busy schedule. They are running multinational companies. Special thank you, both of you. And to my brother, Tyaga, who was there with me throughout, and all the faculty, Saurabh, Nancy, who have worked very hard. We have been working for delegates, all this. And to all my good students, friends, everybody. And if you have missed anyone, we take our apologies. Thank you.
With this, we conclude the 2-day Save the Young Heart conference. Thank you all for your presence, your enriching talks, and to the audience, your patient listening and participation. We hope the conference has a lasting impression on everyone with lessons to take back home, practice and implement. We now invite all the faculty members and organizers for a group photo on the stage, please.
Sorry, I missed few names as I see you. Sahi Lakshmi Garu. She has been an amazing MC. And Miss Prashanti Goswami, actually she has been roaming about with us. Prem Shanti ji, who painstakingly crafted minute to minute. And I think I have to thank everyone, the universe, I think in universe I cover everyone. Thank you.
Thank you. I invite all the faculty members on stage, please, for a group photo. Brother Tyaga, please come on stage. Sister Shantini, please come on stage. Prema Shanti sister and Prashanti Goswami, please come on stage. Thank you all once again. Have a good evening.